And that reference includes the temporal bone today. So what we talked about yesterday was the anterior cranial base. Instead of using SN, we use CCN. Now, to include then the temporal bone,
でこれに側頭骨も加えます。
we go from there back to Porion,
でいるわけです。
completely bypassing Sella altogether.
もうセラ
So we want to go with the sequence in our thinking, in our planning, in our analysis, and in our treatment. We go in the sequence from the cranial base
つまり
to the mandible, then the maxilla,
それから
then the lower teeth,
それが
then the upper
それ
teeth,
次が
and then the soft tissue.
最後は軟組織です。
So this is the sequence now that we're going to do in analysis, in forecasting, and in treatment planning, even in finishing. We start with the lower arch. It's the lower arch that becomes the target that we treat the upper two. Now there's only one exception to that.
でも例外ありです。
And what kind of a case would that be?
それ
What kind of case would we be limited most in the maxilla,
でしょうかというご質問。
cleft palate?
高外裂の患者の場合は例外。
The cleft palate case with scarring in the maxilla, a very tight upper lip,
それ
a deformed premaxillary process.
それから
Sometimes with today with grafts. So in that event, we set up the maxilla and then do everything we can to treat the lower to it.
あの
But literally in everything else, we treat the upper to the lower rather than treat the lower to the upper. Now, if you'll notice in the temporal bone from the outside,
そうだろ
it
う。
comes right over the top of the ear.
このちょうど耳の上
See this crest right here? Now, above that crest, you have a big temporalis muscle. And coming down over that crest in this groove right here
でこの溝になっています。グルー
are
ブに
the
なっています。
posterior fibers of the temporalis muscle,
でこれ
which pull the mandible backward.
後全体
Now, this is opposed by another muscle, which is the external pterygoid muscle, which attaches all the way out here in the infratemporal fossa. Now, what are the limits then of the capsule of the TMJ? And you see it comes out on the sphenoid bone, the great wing of the sphenoid. Furthermore, the middle part, medial part of the capsule is attached to the spinous process of the sphenoid bone. So the spinous process protects the medial wall of the joint. Most people don't realize that the sphenoid bone is involved with the TMJ. The medial wall, but also it holds the border of the capsule. When the mandible opens, in fact, it comes all the way over the eminence and indeed can rest completely anterior to it with no dislocation. All right. So the temporal bone then we're going to take up as a bone as an articulator. So here is a brace.
でこういうのを指示をしているわけです。
This brace runs up to the zygoma. And if we look at it from the outside, you see it's curved in right here.
で外側から見
Your zygomatic bone is out here, and this is recessed.
胸骨で
That's
くぼんでま
recessed.
す。
Why? Why could teleologically we reason that this would be recessed? Notice how this dips in here?
かなりくぼんで
Now
ま
this
すよ
is
ね。
more prominent here, and this is more prominent here. Why do you think nature would do it that way?
Those are muscle.
Protect it. If
Ho-
I fall down,
保護してるんです。こういう形態でもし転
I'm
んだ
going
と
to
し
hit
ます。
here, here.
とここにぶ
Because
つ
if
かっ
I
ちゃ
fall
う。
down and hit the joint and injure it, I won't survive.
もし生
So
存
the
できません。
joint is buried.
したがって関節は
That's the reason it's hard to make an X-ray out.
関
So this joint is concealed in behind the mastoid and the zygomatic arch.
したがって
Now looking from the outside of the joint here,
でこの関
we have, as I mentioned, the suprameatal crest,
さっき言った
which is a heavy ridge of bone.
これは骨がかなり固まってある部分です。リッジになっています。
The supra up above, meatus, suprameatal crest.
自動の上のクレストです。
And we try to identify that in a frontal X-ray.
でこ
We
の
also try to identify the cross-section of the zygomatic arch. If you will notice in your skull,
でこれ頭が
from porion to orbital,
ポリオンからオービタールまで
if you sight down a line between those 2 points,
この2点を結ぶ
that line will exactly bisect the zygomatic arch.
ちょうど今引いた線というのが胸骨球を二分するはずです。
Furthermore, you will see that the fossa is very slightly above the porion.
もう一つ
This places the condyle when it has a normal disc exactly on the Frankfurt plane. Now, on the lateral side
で外側なんですけ
of the
ども
joint,
関節の外側
there's nothing to cover the back end of the condyle.
コンダイ
So the outer one half of the condyle in the human
したがって人においてコンダイルの外側2分の1は
doesn't have anything posteriorly. So you can move the mandible back and push it against soft tissue.
でそし
Now the place you start getting in trouble posteriorly then is on the middle and the medial side. In fact, this skull that I have here is beginning to perforate the tympanic plates.
ビデオで見て
Maybe you can see this one up
見ていただ
there.
いた方が分かりやすいかもしれませ
There
ん。
we are. Now notice that this dentition is very, very badly worn. Notice that this condyle now is right up against the postglenoid process, which is right here.
コンダイ
Notice that it's also flattened
ルでフラットな状態になっています。
on the posterior border there. Now if you can see here, notice that there's just a little hole starting right
これ
there,
ちっちゃな穴が開き始めてるんです。もう少し開いて
where
ます
this mandible is back up against the tympanic plate.
映ります。
It is really non-articular, so people don't like to call it an articular
アー
tubercle.
ティキュラと呼びたくないんですけども
What it holds is really a very heavy ligament
ここにあるのは関
that
節骨
runs
架じゃ
down
な
to
く
the
て
condyle. Now running medially to that and curved, like you see here,
その内側このカーブの部分ですけども
is the articular eminence.
これが
It provides what I call a cam action. That as I operate this,
このふうに動か
and
し
this
ます
comes over, see it's lifted.
こういうふうに持ち上がるこういうふうに持ち上がって上に
See that has to lift.
こういうふうに持ち上がらなくちゃいけないんです
So in motion then, this provides a separation of the posterior teeth.
あります
Now that's the function of that eminence, and that is that it functions as a disarticulator of the teeth. I see the tympanic plate.
個室板が見えます
I see the petrotympanic fissure.
ペトロティンパニックフィッシャーがあります
Some people call it the petrosquamosal suture. Okay, now let's go on to the medial side.
次内側見ていきます
Now you see a large lip on the medial side of this glenoid fossa.
これ関節
That
出てる部分がありま
prevents
す
the medial dislodgement of the condyle.
これが
Notice that then it is exactly adjacent to the spinous process
そして極突起のすぐ隣です隣接しています
and to the foramen spinosum. That right there
極光のすぐ隣です
is the foramen spinosum,
これが
which a vessel comes up for the middle meningeal artery. Now, looking a little bit further inward,
もうちょっと内側を見ていきますと
right there
ここですけども見えますでしょうか
is the eustachian tube.
おいし
Right there where the pencil is where the eustachian tube goes up into the ear.
ここか
Now
ら
immediately in front of that then is this oval foramen
にこの大
which exits the mandibular nerve. The mandibular nerve is pretty big. I saw the mandibular foramen
科学
in
校
an elephant skull.
私象の頭蓋骨の科学校を見たことありますもうほとんど拳
Where it
が
comes out is exactly in front of the condyle.
でコンダルのすぐ前のところから出ていきます
Wonder where the thing is located in a lateral head film.
でラテラルヘッドフィルムでこれで何がどこにあるか分かるわけ
There it is. I'm holding up the whole skull there.
こういうの
Look at it.
これで立ちます
That's the foramen ovale.
これが
Okay. Now we come up here and we have this prong which comes out here
今度はこう分かれている部分があります。
And this is called the inferior root of the zygomatic arch.
これは
This
何ていうのルートの部分と言います。
This is the suprameatal crest that I talked about, and it
自動の上の部分
forms the superior root of the zygomatic arch.
そしてこれが
The very end here, this
一
is
番
smooth
端の部分、スムースな部分があります。
and it's curved.
滑沢で、カーブしています。
If you notice, it ends then in a butt with the zygoma. There tends to be a little lip right there.
ここに小さなリップの部分がついています。飛び出しています。
The master muscle attaches right through here then.
抗筋がここに付着しています。
It attaches all the way to the maxilla here
で、上顎までずっとついています。
and all the way to the temporal bone right here.
So that's
This little notch right
こ
here
の小さなノッチ、
is significant.
これ
And
は
the reason it is significant is because it holds a part of the gala aponeurotica,
するからです。
the cap that goes over the top of the head. The
You mean
cap
the-
that goes over the top of the head. This is a cup. It's like the geodesic dome.
ドーム
It is laminated and has two plates, which makes it doubly strong.
ですから
What's this look like?
この形から見て何を連想されますか？どういう形だと思われますか？
If I make a cross section through
で
here,
ここで断面を取ったら
that's a bridge.
橋の形になりません？メガネ橋の橋。
So this bridges from front to back
前後をつなぐ橋だ
and
と。
from side to
それ
side.
が左右を飛
That
ばしだ
means
というこ
it's
とです。
supporting things from the outside,
というこ
holding
と
things up. So this is a double bridge.
え
Now, bridges have abutments. So at each corner,
これそれぞれの角には
we have an abutment.
橋
So
が
these have names. On the front, this
前
is
方
called
では
Terion.
ヘリになっていると思います
At the top, it is Bregma.
と
At the back,
後
it's
ろ
called Lambda.
ラムダと
And back here, it's
もう少
Asterion.
し後ろに来ると
So you have one of these anthropologic points at each corner of the parietal bone. So the parietal bone is designed.
そこでこの
Now, if you look right in front of that,
この前の方から見ると
there's a slight little groove here. Why? Because this isn't strong enough to hold up a big masseter muscle.
もう
This
一つ支力が
fascia
ないとダ
holds
メなわ
up
けです。でこの腱膜が
the
その
zygomatic
働きをします。で胸骨を支えているのが胸骨筋を支えているのが腱膜
Now
な
you
ので、
understand
こ
why
れ
these,
を持っ
the
て後筋
suture
を
runs
支え
down the
ます。
middle because as we bite down, we compress the top of our head. This particular part of this fascia
でこの腱膜ですが
also is heavily endowed with nerves.
でるわけです。
Now, I had a patient
それで私の方の患者さんで
that had been shopping in one of the Army surplus stores that we have in the United States. Anyway, she was going along looking for something,
で
and
そこ今この方買い物に行って
somebody in the next aisle had reached for something and knocked a box off, and it hit her right on this
まさにここの
aponeurosis
拘縮しました。
because it got inflamed, maybe a tiny bit of hematoma,
まあちょっと
and this lasted for months.
でそうないか
So she finally got to me, and I made the diagnosis, and I said, sure you did, you had this. And what kind of treatment? Well, nobody gave her any treatment for it at all.
で
The
まあ
spastic contracture had turned into a myocytic contracture.
で
So I eventually got her well,
でまあもちろんそのうちにだんだん良くなりましたが、
and she sued the company for having that kind of a display that was dangerous for somebody pushing a box off on her
で
head. So the insurance got an oral surgeon as a witness for the insurance company. And he got on the stand and said there was no relationship whatsoever with a blow on the head up here with the temporomandibular joint.
で
Needless to say, he didn't know his anatomy very well.
そういう
And
こ
it
と
was a subdermal little hematoma there. So that I view the parietal bone then is a part of the lower jaw. If you will notice, a ridge of bone comes off the frontal bone right here, passes back onto the parietal bone, and it comes down then and seats right against the temporal bone back here. See it? Now this is the outline then of the temporalis muscle. Now we see in nature the muscle not attached to the ridge. The ridge is there for a reinforcement, and the muscle is attached to this plane. But if you notice then you have a bridge. And what is it doing holding up this muscle? And then of course the aponeurosis is holding this up so it can help support the mastoid. Now you begin to see anatomy in a different light, don't you? All of this architecture here is in support of protection of the brain, plus on the outside it's there to support all of the forces that are coming this way and this way over the top of the head. So we have the frontalis that lifts our forehead, and all the way back now to the hairline back here, which is the aponeurosis. We have then this bone with a big knob right here and here. Notice the relationship of that to the occipital condyles, just slightly posterior to the occipital condyles. Do you see it? This is the mastoid. Why do we have these two big mastoids on either side? So the mastoid now is larger in the male. So the mastoid is a lever. And it gives rise then to the sternocleidomastoid muscle, which permits you to turn your head side to side. So because it is slightly in back of the occipital condyles, it can also help hold your head up a little bit. Now immediately on the inside of that there's a groove. What's it help hold up? The posterior belly of the digastric. So this holds up your tongue. Holds up your hyoid. So the drape of your tongue comes all the way back here off of your temporal bone. Alright, now in front of this is a scroll, which is a tympanic plate. It encloses the middle ear, and it lies over the petrous portion of the temporal bone. Now, let's look at the petrous portion of the temporal bone then, and see if we can determine then why it is so significant. This wedges right here in between the occipital and the great wing of the sphenoid. It is sort of a pyramid shape, and it's the hardest bone in the body. Take an x-ray of a newborn, and by far the dominant bone in the head is in the petrous portions of the bone. Now right in here it contains the semicircular canals, and it also has a course for which nerves. What nerve comes out right here of the brain and goes in? This is the internal acoustic meatus. This right here is the internal acoustic meatus. What goes in there? The eighth nerve, which is the acoustic, but also the seventh nerve, or the facial nerve. Both of them come through the petrous portion of the temporal bone. The eighth nerve then goes to the eardrum, to the tegmen of the ear. The facial nerve runs through this bone. And where does the facial nerve come out? The styloid foramina. Notice that there's a foramina right in back of the styloid. Can you see it? Can you see that? This is where the facial nerve comes out. So the facial nerve, you remember, it's like a hand. It comes out here in the neck, and it comes over the face here. Seventh nerve comes out there and comes over the face. So it comes out right there. So it courses through this bone. Well, what about this now? if I've got a bone here that's the hardest bone in the body, it's got my organ of hearing, it's got my organ of equilibrium. If a nerve comes through,
でそこをその神経が通り抜けているわけです
which goes to my face,
で顔に
the nerve comes in for my hearing,
それから
there's a big hole right here
もう一
underneath
つ
it.
この下に
That's the carotid canal. The carotid artery comes up, bends and comes through and goes up to my brain. Now immediately lateral to that or posterior to it, the whole wall of the jugular foramina is protected by this hard bone. Now notice also that the jugular foramina is immediately lateral to the occipital condyles.
それが側にあります
Remember what I said? Nature's not going to stress the blood nerve supply. Now what does the styloid do? Holds up the tongue
の役割は
Holds up the
舌の位置を整え、そ
and
れから
holds
咽
up the
頭の位置を
hyoid.
整え、舌骨の位置を整えるものである。
So it is a tie. It is a suspender.
サスペンダーの役割をしている
All
も
of
の
these
です。
things are hanging on it. Now you begin to see why I consider the temporal bone
こういうことから言って、
every bit as significant as the sphenoid bone.
そう
Because we've got all of the suspension here, all of the suspension of the pharynx coming off
で
here,
すからその咽頭
and out here on the petrous portion of the temporal bone, all the way out to the end, what other muscle is attached? The levator veli palatini. So what does the levator do? It
居上する筋
raises
肉
the palate. Every time I swallow, I have to close off,
ですから
my
演芸するためにその
or else the food will go the wrong way. Every time I speak,
それから話をする
I have
喋
to
るために
modulate my soft palate,
軟口蓋をいろいろとその操作しているわ
and
けで
it's
あります。
raised with the temporal bone.
でこれ
I've got to believe then, with all of that anatomy and all those vital things, that this is a very important bone. Several years ago, there was a student in the class. His name was Juan Canute from Madrid, Spain. And we went to lunch one day, and he says, Ricketts, what is normal?
で
It's a good question, isn't it?
良い質問だと思います。
We have a person playing center for the New York Knicks
ニューヨークメッツのセンタープレイヤーがいますけども、
who's 7'2" and weighs almost 300 pounds. I wouldn't want to be the one that tells him that he's abnormal. Willie Shoemaker has won more money on horses than anybody else. He's barely 5 feet tall and weighs about 105 pounds.
彼は逆に
Is he normal or abnormal? So these are the kind of problems you have in describing normality. And one of the problems that we have then is to find methods of determining what is normal or abnormal so that we can talk about it and communicate it and learn about it at the clinical level.
では
So let me talk about this just a little bit as a preface to going into what we call the scientific method and the statistical method. First of all, I can, with orthodontic experience, with just everyday work, I can eventually find an idea of what I want to do and what is normal and what's abnormal to me. So this is practical experience, and I can learn from that. So we can say that this is maybe pragmatic or empirical, this method of achieving an idea or a concept of normal.
経験的な方法
Now the scientific way is to measure, and on the basis of common experience, everything in nature behaves on a curve of distribution. When we take a measurement and then the incidence of that measurement,
見ます。
or the frequency of it,
すなわちその頻度を見るわけです。
then you will see that everything falls on a bell curve. It's an even-shaped, symmetrical curve. So it becomes a matter then of selecting what part of that curve you want to call the normal. If you just take the very, very center of it, you may say that that's the ideal. If you take a little bit more of it, you might say, well, okay, that's still pretty good. That's still ideal to me. Then you get to another level. Well, it's not ideal and it's not quite desirable, but still, I'll accept it. But at any rate, you have now this curve, and the way of determining it is how much of the curve you're going to lump off and call it what. So we're going to be talking about the top of the curve and how much of it we're going to cut off. And so we can call that the normal.
で、どの範疇にすれば、どこで切ればノーマルと呼べるのかを考えます。
Or the clinical norm.
あるいは、
Now we can do a statistical term and call it standard deviation.
これは、
So depending upon how critical we want to be,
だから
we can say then that one standard deviation is a clinical deviation. So we call this looking at something from the top down, using the scientific method and using the statistical method to refer to. Now there's a third way.
それから3つ目の方法があります。
And this is looking from the outside in. Something that's obviously not desirable,
明ら
or
か
not
に
acceptable.
も
We'll call that abnormal.
うでこれを
This is then like studying the pathological.
従って
It's a process of elimination.
で
Both the first and third methods are a little bit empirical.
で
And they are valid, though. They are valuable.
しかし有効です。それなりに価値があります。
But very frequently you can't communicate that feeling, that intuitive sense that was developed. Now, the fourth way
4つ目の方法
is to investigate the basic field of basic science and the secrets of nature.
4つ目
It's a development of biologic principles, because there may not always be a absolute answer to a problem. Okay, well, Joe, what kind of lip does this patient have? Are the third molars forming? Are they going to be there or not?
で
The patient got a tongue habit, a swallowing habit, or a breathing habit. Each one of those is an input into his decision.
周壁がある
So when you get right down to it, his idea of normal
では
becomes more and more and more of an individual thing, doesn't it?
こういうふうに
In this sense, cannot be an absolute concrete situation. One of the dictionaries that I looked up the word normal, and it came out to be anything that was not abnormal.
Oh, that's cheating.
Yeah, this is what I just talked about: pragmatism, scientific measurements, pathologic extremes, and their elimination,
3番目はこの
and then finally the teleologic reasoning from the laws and tendencies of nature.
で4つ目
So let's look now at the scientific method,
それではここで科学的
just the matrix of it. And anything that we want to do in science goes through these 4 stages.
で科
The
学
first step is to observe,
まず
establish a way of measuring it,
でここではこの計測する方法をまず確立します
measure it and record it.
で
That's the primary function of this. Anything you want to do a scientific study, this is what you have to do.
それ
All
が
right, now you have a group of records.
これで一連の記録が取れました
You've accumulated some data.
で
Now you have to organize it,
次に
separate it,
で
and classify it.
で分
Put it into groups
類でグループ別に分けます
so that you can see whether one group is similar to another group
そうすれば一つの
and see where the differences are.
でまたどこ
Very simply, that's it.
まあ端的に言えばそういうことなんですそれだけです
But now once you've done that, then you have to get an idea about what the significance of it is. So you begin to use logic
そこでロジックを
and you hypothesize.
で仮説を立てます
This is a hunch, a guess, an assumption, or a supposition. This is association. So once you've gotten this far, then you have to go to the last step.
でこう
and that is verification of your guess.
で、
So you set up experiments.
そこで一連の実験をデザインします。
Use one group as a control to measure the next group,
で、そし
and
て
now you supply the statistics in order to see how valid relatively they are.
そして
So often, however, a hypothesis gets accepted
残
as truth
ところが
because people can make it sound awful good and make it appealing.
なるなら
Now, when you can verify your idea
である
with some evidence,
その時にはもちろん証拠が必要
it
で
becomes a theory.
す。で、実証
When this is useful at the clinical level, it may become a principle.
それが
Finally, then, if it's always true every time and every place,
で
it
どの場
becomes a
所
law. Theories are worked out to explain different phenomena,
ここに書いて
and we have to express them mathematically.
でこの理論
This helps us communicate then. Finally, then, in order to understand something, we have to understand the mechanisms by which it works. Once we can reach that level, then we can begin to predict.
メカニズム
All right. Now, we have truth
真実があって
as something that is basically right. What is a principle?
原則
General truth,
一般的な真実
not without exception.
例外はありです
We're using our minds.
で我々はここで自分の
We're seeking facts,
あ
and we want to learn,
そして我々は学習したいわけです学び
which
たい
will give us knowledge, understanding,
それが
so that we can accept responsibility.
これができれば責任を取ること持つことができます
So we have to communicate.
で
What you say and what you mean and what they understand may be different.
そうでもさもなければ言ったことと
I've come out of lectures and had somebody come up to me
よくこういうことがあります
and said, "You absolutely confirmed everything I have believed."
でその人
I said, "What do you mean? Tell me exactly."
じゃあどういうこと
And he would tell me. I said, "That's not what I meant at all.
彼がいろいろと
You only heard what you wanted to hear."
そうじゃなくて
So we have science in order to protect ourselves.
おする
There's
わけです
abstract sciences, there's physical sciences, there's biological
抽
science.
象的
So we say that we have inductive and deductive logic.